Hello, how's it going? Today we're going to talk about goniometers or goniometry in general. Later on I'll do a couple videos and we'll actually do goniometry on different joints like shoulder, elbow, and hand. Today I'll just talk about the equipment itself, and I'm going to be using goniometers that I got from Anthroflex from Amazon. If you're looking to buy a kit, I'd say it's worth a shot. They're pretty good. You get a nice little package to put them in, and it was very inexpensive. I think it was like 16 something for a kit, and it actually has several different sizes here to utilize. First one is your foot long goniometer. Now they all have the same parts, so I'll discuss the parts with this one, and then we will talk about how you utilize it in general. But all of them have the body, okay, which is this big circle here. Obviously, depending on if you're using one for the wrist or a smaller joint area, the body is going to be a little bit smaller, and then you have the stationary arm. Now, both arms look very similar, right? You got one that's mobile, one stationary. If you're not sure which is which, degree-wise, if you're taking a measurement, it's not going to make a difference. But if you wanted to use, use the right one and put that one on the stationary side, the one that's attached to the body is the stationary arm. So the one that's attached to the big circle area, that's going to be the stationary arm. The one that's free hanging and attached via that fulcrum right there, that area, the access point, that's the movable arm. So some of the things that you'll see is they have measurements on them. If you're trying to maybe take a measurement from one area to the other, because you can use this for more than that particular reason as far as a joint measurement. But if you're trying to track, trying to put landmarks, you can do it that way. If you're trying to measure a scar or a point, you can utilize it that way. But for the sake of goniometry, what you're doing is that you're trying to measure the degree of movement from a particular joint. Goniometers are used by different healthcare professionals. Doctors use them, physical therapists, occupational therapists, chiropractors as well, and I'm sure the healthcare providers. What you're trying to do with a goniometer is usually look at the range of motion that a particular joint is going through, and with that we can determine if there's an issue with the arc of movement of a particular joint, or in other cases if we're doing stretching or we're trying to strengthen, we can kind of see how much better either the muscles have gotten or the flexibility of that joint has gotten as the degrees of movement of that joint increase. So one thing that's really important for goniometry is just being familiar with the degrees of motion. Major landmarks would be obviously 0 point, 90 degrees, 180, and so forth, so that you can kind of track it from there. Now, when you are using the goniometer, you have an access point, and that access point needs to be, depending on the joint that you're looking at, in the correct location, so that you get the right measurement when you take the degree, when you look for the degrees of motion. So if you're looking at a shoulder, for example, you're usually looking at the humeral head area, or the access point should be around where that humeral head is. Okay. Now, obviously, I'm not doing that today, but it's just to give you an example. So what would happen is, as you put the goniometer in that section and the movement is executed, then you would follow with the movable arm along parallel to the humerus, and the stationary arm would remain parallel to the trunk of the body, and that'll give you your degree of motion. I'll put it a little bit closer, and as you can see, right around there you have your 90-degree mark, 180, and if you can see the numbers there, you can follow that track. So we're going upward. Okay. So this particular goniometer is a 1 foot goniometer, and it's usually used for bigger joints. like your shoulders, your hips, your knees. You can use it on, for cervical motion as well, if you track it from up here. So this particular kit, like I showed you, has the foot-long goniometer, has some other goniometers as well. This one's probably good for smaller joints, but not too small. For maybe your wrist, elbow would be good, ankle as well. It has a good part for landmarks as well. So if you're looking at wound care or anything like that, or you're kind of trying to track the size of a wound, it's kind of a pretty good one to use. Generally speaking, I prefer using the foot long for the most joints, and then when I get to the smaller joints, I'll show you. This one has a few as well for smaller joints. You have this one here. It's about an 8-inch one. Again, you can utilize that as well. You have another one that definitely would be for like a wrist area or smaller joints as well. But usually I'll use either this one here. If I'm going with smaller joints, I usually default to this one here, which I like to use for the wrist and those areas. And the same, it looks a little bit different. You got a half circle here, but again, this is the body, okay? This is a stationary arm. This is your movable arm, okay? And this is your access point. So if you're looking at a wrist, for example, like, you have the forearm over here, okay? My pinky side right here. So I would put this and then, parallel to the metacarpal joints here, the metacarpal area, I should say. So it'd be here, the stationary arm would be parallel to my forearm. Okay, you have my access point in my wrist area, and then the movable arm would follow and be parallel to my metacarpal area here. And so for example, as you track, you'll get your degrees of motion. And then you'd be able to take that measurement and see what that gives you. So I prefer this one for the smaller joints. Again, it's your preference. And then this particular kit had this one here for the fingers, and it's kind of cool because one kit gives you pretty much all the different goniometers you would probably need. This one's a little bit different because when you first look at it, it's like, okay, which part is which? I think most folks will try and put this as a stationary area, and if you do it that way, you're gonna end up getting some probably inaccurate readings. If you notice, I'm not sure if you can see it in the camera, but it has an area here for hyperextension, because some people do have fingers that will hyperextend, or joints that will hyperextend in their hands. So that's kind of a cool benefit there. But what I would recommend is if you are utilizing this one, and you just this would be your movable arm. Remember, the body is usually the immobile side. So again, if you have it, where the person's extended, at this point here, and then as they are bending their joint with the finger goniometers, the access point actually always goes on top of the joints. You notice in most of the other areas, the access point was on the side. With the fingers, it's funny because you just put it on top, and most folks sometimes forget that, and they try to put it on the side, but that would be incorrect. It just rolls along the top of the knuckles. For example, I'm doing the MP flexion, and then the movable arm will follow it, and then that'll give you a reading. And then, as you can see, I got from this one right here about 80 degrees. Okay. If you notice here in this PIP joint, it'll give you, we got 100 degrees there. Okay, so as you can see, that part. One of the things I'll tell you that I tell most students is that when you're doing goniometry, you do want to have an idea as to what the normal joint movement is per the textbook as well. And if you're doing a test, or if you're working with a patient, if for some reason you forget, I always tell people you have a cheat sheet with you at all times, your own body. Unless you have some problems with your joints where you don't have full motion for whatever reason, you could always, kind of do, let's say you don't know how much the fingers are supposed to go as far as how many degrees, you could make a fist, or depending what joint you're trying to do, you can do that motion, kind of check the range of motion on yourself, and then you know what your patients are expected to do, assuming you have full range of motion. But obviously that'd be a way to kind of get around things if you don't have it memorized. But depending on what area you're working in or what setting, you're going to be doing this pretty often, so it's a good idea to make sure you have the typical range of motion memorized for each joint that you're going to be looking at. Now, a separate goniometer for fingers that I prefer, it wasn't part of this kit, so I did get it separately, is the metal goniometer. This one's by Blue Jay, it looks like, and it was separate. This one's like $12 just by itself. I would recommend, if you're working in hand therapy, or if you're working in an area where you're going to be measuring fingers a lot, I'd definitely go with the metal goniometer. I think that this one, or this type, is the easiest one, or it just kind of seems to work better, because it's flat. It sits on to the joints or the areas that you're trying to measure a little bit better. So again, the access point is on top of the joint, and then when you're doing the measurements, it gives you, I find it's easier to work with. Okay, so as you can see, you have the measurement there. Some folks like to use this side as well. The good thing with the goniometers is that because it's degrees of motion, as long as you put it in the right place, you're gonna get the measurements correct, even if you use the wrong side and you know how to read the degrees. Remember, they're usually going up, so from 0 to whatever number that you're looking for. Some people sometimes read the opposite side, and that's for any joint, and then you get inaccurate measurements. If you get a number that kind of looks weird, as long as you have a basic understanding of geometry and arcs of motion, you should be okay. But again, if you're not sure, just check the textbook or check your own bodies and see. But with this one, you can see the movable arm is this. It's not even a half circle here, but this is the body. You still have your access point. So this is your stationary arm. Now you don't have to always follow it along like you might do with some of the other joints. I mean, if you get them in the right position, you could drop it in place and then make it meet them where it needs to be. And as long as you put it in the right spot and align it correctly, you'll get the right measurement. But we'll go over that kind of stuff in another video. We'll cover the different joints, starting with the shoulder, elbow, wrist, and then we'll go to some of the fingers. All right, go ahead and if you have any comments or suggestions, please leave them for me. I hope you like it and share the video so that we can continue to get other things out there for you. So if you have any topic, just let me know. Thank you.